Good evening, everyone. I'm Christy Breslin from WMAR-TV and Harford TV.
And I'm Don Mathis from the Harford TV Foundation. Christy and I are your hosts and moderators for tonight's special program, Facing Addiction in Harford County, Facts and Fiction about Marijuana.
And I would like to recognize County Executive Bob Casserly for being here tonight. Bob, where are you? Well, we appreciate all his support, so we just wanted to give him a shout out as well. I cannot see anything up here except for my wonderful co-host. We want to thank all of our sponsors for their support of this special program. Our Recovery Champion sponsors are Voices of Hope, APG FCU, Harford County Government, Ashley Addiction Treatment, Magnum Advisors CPA, McComas Family Funeral Homes, Susquehanna Workforce Network, American Design and Build, Linda Norman, Kay and Alex Dietz of Garsu Realty, Harford County Public Library, Veni Vidi Vicis Wellness Center, Reaching for Recovery and Beyond, Catherine Howard, Richard Parks, and Vincent Does Magic. Our recovery endorsers are Harford Community College, Joreen Jameson, Robert and Susan Lidke, Don Mathis and Suzanne Tuthill, John Maffa, and Larry Scanlon. Thank you all, because without your support, there is no way that we could make this program.
Tonight, you'll hear the latest news and consequences of the use of marijuana from our experts about Maryland's July 1st, 2023 legalization of recreational marijuana and cannabis products. Christy, let's get started.
And now it is my pleasure to introduce our keynote speaker, Dr. Sharif Osman. Dr. Osman is a physician at the University of Maryland Upper Chesapeake Medical Center, board certified in internal medicine and certified wound care specialist. He also serves as a medical director of the Center for Wound Care. This evening, he will present a doctor's perspective on cannabis use, the significant risks, the limited benefits. Please join me now in welcoming Dr. Osman.
Hello, folks. Thank you for having me today. I want to chat a little bit today about this marijuana thing. You know, when I was in high school, back in the 70s, we had a few kids that we called potheads, you know, and, you know, they'd smoke a joint behind the gym, and occasionally they'd fall asleep in class, and that was it. But boy, have things changed. Things have changed dramatically. You know, there was an incident with my grandson last year that really bothered me quite a bit. He's not a marijuana smoker, but he was working in an ice cream store, and at the end of the day, the kids that were working there decided that they would close up, and one of them pulled out a joint, and they smoked the joint, and he got in his car and was driving home. And he realized that he couldn't drive. So he pulled over at the side of the road, and after a while, a policeman came by and knocked on the door, asked him what the problem was. He told him exactly what happened. He called an ambulance, took him to the hospital. His parents came. They tested him for other drugs. He didn't have any other drugs in his system. But this goes to show you how potent this stuff can be, especially in somebody who is marijuana naive. That means somebody who really hasn't had a lot of marijuana in his system. And you can see that this easily could have gone in another direction. Marijuana, hemp, ganja, weed, hashish, it's been around for thousands of years. And the first recorded signs of marijuana use for medicinal uses was in China about 8,000 to 10,000 years ago. And then it gradually started spreading westward into the Middle East and eventually into Europe. Its psychoactive properties were used for ritual purposes, but it was also used just to get people high, you know. But its medicinal uses have been used for thousands of years because there were very few alternatives in those days, you know. And cannabis has always been a double-edged sword. And one of the reasons for that is it's not one compound. It's basically hundreds of different compounds that were never really studied very well. We're in the infancy of understanding the effects of these. And these compounds affect your metabolism in different ways, and they affect the metabolism of different people in different ways. And they also interact with all the drugs that you're taking, and we have no idea how they interact. We go to the dispensary, nice people, you know, usually they have good intentions, but are they pharmacists? You know, do they know what your underlying medical conditions are? Do they know the interactions between that marijuana that they're going to be advising you to take for your insomnia, for your headache, for your anxiety, for your stress, how that is really going to affect you? Not really, because there are no studies to give them that type of information. As the laws has been loosened over the years, growers are in a race to produce more potent and more varied hybrids of marijuana. And nobody knows exactly how these new hybrids and these potent varieties are going to be affecting people. But they're released as fast as they are produced. Patients with underlying mental health conditions are at great risk for developing depression, schizophrenia, bipolar disease. And I'll give you an example. So I had a patient, lovely lady, you know, has 2 kids, great husband, wonderful job. She had a history of depression when she was younger, and it was treated. And then the stress and anxieties of modern life were starting getting to her. And she decided, you know what, let me try vaping. Maybe that will help with this stress. So she started vaping. And unfortunately, instead of relieving the anxiety, it would relieve the anxiety temporarily, short term. But over time, the anxiety would build, and she would take more and more vape products in order to relieve the anxiety in the short term. And eventually she would say, well, you know, maybe I'll try a little alcohol, and maybe that will take the edge off. And she started drinking alcohol. Well, she fell into a severe depression and just started to have suicidal ideations. Luckily for her, because of her previous history of counseling, she knew that this was an emergency situation, and she went to the hospital, and she was admitted to the psych unit, and she spent a week in the psych unit, and she got out of the hospital and is now getting intensive outpatient therapy, and she's doing great. But you can easily see how this could easily have gone the other way. You know, and we have no idea of how many people who have committed suicide because of their aggravation of their underlying depression by marijuana, because there are no studies. And when people commit suicide, you know, the cause of death is whatever they committed suicide with, and that's it. And that's the end of it. So there's a lot going on that we don't know. And cannabis, of course, you know the negative effects. You know that it affects memory and attention and learning, and with that adolescents, when they use it regularly, it can alter their brain development. It can actually reduce their IQ by about 5.5 points. It can actually reduce the size of their hippocampus, which is part of the brain that's involved in learning and memory. You know, there was a 2025 meta-analysis which basically combines a study that combines multiple different studies, and it shows that cannabis increases the risk of acute coronary syndrome, stroke, and cardiovascular disease. You know, and how does that work? Because cannabis actually excites the sympathetic nervous system, so it increases the amount of oxygen that your heart requires. okay? And for somebody who has a heart condition that needs all the oxygen that they could get, when that occurs, it can trigger coronary artery disease, it can trigger an MI, and often it triggers arrhythmia. It's very common to get supraventricular tachycardia and atrial fibrillation with cannabis use. Now, that's besides just smoking it, okay? If you're smoking cannabis, the rates of chronic bronchitis are really, really high. And the amount of tar is 3 times more than in tobacco. So that's another lung condition we haven't even started to get our heads wrapped around. You know, eventually people will start to get COPD, which is emphysema. Cannabis, again, can cause significant withdrawal symptoms. You know, when you stop it, patients often who have been using it for a long time will develop abdominal cramps, chills, nausea, headaches, restlessness, unable to sleep, and it can last for days, even weeks. Then there's this other syndrome that people get, which is the cannabis hyperemesis syndrome. And this has become very, very common. We're seeing it in the emergency rooms all the time. Patients come in, they're having nausea, vomiting, abdominal pain, okay? They do the studies, the CAT scans, the ultrasounds, the blood work, nothing going on, you know? And then they come back to the emergency room, same thing, nothing going on. And it gets worse and worse and worse. Now, sometimes it gets so bad that patients are actually getting admitted to the hospital. Interesting thing though, these patients get a lot of relief from heat. So they are often in the shower 10, 20 times a day running hot water on themselves because that's the only thing that helps relieve the nausea and the vomiting. Sometimes they will go to saunas, sometimes they'll use heating pad. Some people have actually gotten scalded because they've used so much heat in order to relieve these symptoms. Patients are getting admitted to the hospital. There's a protocol at Hopkins right now on what to do with these patients. Sometimes they need drugs like haloperidol, which is an antipsychotic drug, amitriptyline, which is a tricyclic antidepressant, and they use, believe it or not, capsaicin cream, you know, that stuff that you can get from the pharmacy that rubs in on your leg, because the heat from that capsaicin cream helps reduce their symptoms. So I'll give you an example of a patient I saw. I have a wound care patient that I've been seeing for years, because he doesn't reposition himself. We heal the wounds, the pressure ulcers, they always come back. We heal the pressure ulcers. And then he stopped coming for a while. I called his mother and said, hey, what's the deal? He says, well, he's been to the emergency room, you know, for off and on for the last few months. I said, well, what's going on? He has nausea, vomiting, abdominal pain. And so they found anything? No, the CAT scans, ultrasounds. Well, you know, he's smoking marijuana and vaping and using edibles. She says, yeah, because that helps relieve his anxiety and his stress, and he likes to do that while he's watching his anime films on YouTube. I said, well, you know, he could be having this hyperemesis thing. And eventually he came back and I talked to him about that. But you think he'd want to stop his marijuana? No way, you know? You know, it's so ingrained in his head that this marijuana is such a great thing because it gives him a little bit of euphoria temporarily. And to help him wean off, we've really been trying everything to help him wean down a little bit. And it's been successful. He uses a heating pad like all day long. And again, that's one of the signs of this hyperemesis thing. You know, there was a patient of mine, high-level executive, okay, and really terrific guy, you know, charming, funny, engaged, and he was getting massage therapy, and he mentioned to his massage therapist, hey, you know, I can't get to sleep at night because my head starts racing with all these projects and things I'm doing. The massage therapist said, oh, well, why don't you try these gummies? So he started taking the gummies on a regular basis, and it did help him sleep, no problem. But then over time, he started losing interest in the activities that he normally loves, and started to have a lethargy, and started to feel depressed. And he never put it together that it has anything to do with the marijuana, because the marijuana was helping him sleep, so it has to be a good thing. And the marijuana that he was purchasing, actually the cannabis edibles that he was purchasing, were all natural and organic. And so they can't be bad. And eventually I saw him in the office, and he was so depressed that I actually put him on an antidepressant. We talked about the marijuana, we stopped the marijuana, and eventually he got better. But the highlight is the issue of the patients often can't put the issues that they're having and relate it to the marijuana that they're using. And part of that problem is marijuana stays in your system for a long time. It's not like alcohol that gets out of there really quickly. It's absorbed into the adipose tissue, which is the fat cells in your body, and accumulates in that. And it can take up to 30 days to clear. So if you're taking it on a regular basis, you're getting higher and higher and higher doses and have no idea that that's even happening. So the bottom line is there are a lot of problems with marijuana being released the way it is right now. You know, I always thought that marijuana should be decriminalized, because I don't think that anybody who smokes a joint or anything like that should go to prison. But I don't think that you can go to any dispensary and get any type of marijuana that you want in any dose you want, okay, without any idea of the effect that it's going to have on your system, and have it so available that all these kids now in school are vaping and using edibles on a regular basis. You know, eventually this is going to catch up with them. There's going to be cognitive issues, there are going to be lung issues, there are going to be endocrine issues, you know, because marijuana can also reduce and affect your hormonal metabolism, especially, and this has been studied in testosterone, because it reduces, long-term use can reduce testosterone production in men, but I'm sure it affects other endocrine hormones as well. So we have a lot to work with. You know, it's the wild, wild west now. And we got to wrap our heads around how to deal with this very, very difficult problem, how to educate our kids, how to educate ourselves, and how to be more responsible in the use of cannabis products. Thank you.
Now, before you go, Dr. Osman, I have a couple of questions, because you've given us such insight, because this really has become such a big problem, and to hear your medical perspective, and there's a lot of misconceptions out there, and that's one of the reasons why we're here today, to really clear them all up. So what I wanted to ask you is, how would you treat one of your regular patients who discloses to you that he's been smoking or vaping a lot of cannabis and is worried about it? Like, what would you say to them? And would this be a confidential conversation?
So obviously it would be a confidential conversation. But the bottom line is, the first thing you want to know is why they're doing it. You know, why are you vaping? Are you vaping because you want to get high? Are you vaping because you have a medical condition you want to address? Are you vaping because you're anxious? Are you vaping because you can't sleep? So we need to know exactly what the issue is, and then address that particular issue in that way. So if it's a medical issue, we need to address that from that area. So if it's an insomnia, there are ways. There's something called sleep hygiene, which is a whole program that I put people on how to address their sleep. You know, actually, one of my favorite things is an app called Calm. It's awesome, you know, because it helps get you out of your head at night. But that's how I would address it. And then I would try to minimize the amount of marijuana that they're taking on a regular basis to avoid that buildup that occurs if you're using it on a regular basis.
Absolutely. Now, the latest edition of the Diagnostic and Statistical Manual of Mental Disorders, now this was published by the American Psychiatric Association. It recognizes cannabis use disorder as a problematic pattern of cannabis use leading to clinically significant impairment or distress. This reflects an important shift in understanding, away from outdated beliefs that substance abuse disorders stem from personal failings or maybe lack of willpower, and towards recognizing them as legitimate medical conditions. So, Dr. Osmond, what I'm asking you is help us understand why cannabis use disorder is formally considered as a disease.
Because it is. It is a disease. You know, a disease is something that causes harm to someone. And the use of cannabis in some people for a certain amount of time will result in harm. And basically what they're saying is if the cannabis use is resulting in significant harm to that person, this is a disease. And just like any disease, it needs to be treated. And that's why it's in that DSM, you know, because there are treatments. Some people actually need to be hospitalized or put in inpatient in order to detox from marijuana and cannabis use. The use of edibles is extremely problematic because you can get extremely high doses of it over a period of time, and you get a tolerance, so you don't even realize. You're going from a 10 milligram gummy to a 20 milligram gummy to 2 20 milligram gummies to 3, and you get a tolerance to it, and you keep chasing that high, and then you get significant side effects as a consequence.
Now, many people who are in recovery, they talk about their drug usage as, my brain got hijacked by the drugs. So help us better understand how cannabis affects a person's brain. Is the brain development of a teenager the same as the brain of a person in their 30s and 40s and an older person, maybe say 65 and older?
Good question. Good question. So the bottom line is the brain in adolescents and younger people is developing. And there are definite studies that have shown that when a child is using marijuana, cannabis on a regular basis, that stunts the development of that brain. There is actually they've done studies that show about a 5.5 point reduction in their score for their intelligence, and there is actually a reduction in the size of their hippocampus, which is part of their brain. This after the age of 25, this doesn't seem to be the issue. And there are some studies that show some of the psychiatric effects of marijuana can be resolved over a period of 30 days in people over 25. But in younger people, the changes can be permanent.
Thank you so much. And finally, Dr. Osmond, I know you're the proud grandfather of Noah, who's just entering college, and there's a lot of anxiety about college. I have an 18-year-old that's a freshman, and of course, you know, this is a big concern because it's become such a big problem. So what have you said or asked him about drugs, especially cannabis, as he gets ready to enter the new expanded social network at college? What is your advice to him? What would you tell him?
You know, he's been exposed to all this, you know, from middle school. So my advice is first to understand why would you want to use drugs. you know. And if you're going to try them, at least be open with me and let me know what you're using. I found that just saying no and then cutting them off is probably counterproductive, because you want to build a relationship with the child. You don't want to have them sneak around and cut you off with regards to that conversation. Because it's everywhere. They're going to be exposed to it. Somebody's going to offer it to them. And if they do offer it to them, you want them to be able to talk to you about it and to discuss it and to help discourage them from going down a path of regular use. It's the most important thing is the communication.
Okay, thank you so much, Dr. Osmond. I mean, your insight was remarkable, and there's so much that we still have to learn, but like you said, knowledge is power, communication is key. So I thank you very much. Please give a round of applause to Dr. Osmond. So that's going to bring us to meeting our first panel this evening, Cannabis Law, Policy, and Public Health. Lauren Levy serves as the health officer for the Harford County Health Department. Her career includes key leadership and academic roles, including managing director of the Law and Healthcare program at the University of Maryland Francis King Carey School of Law, and research associate in the Department of Epidemiology and Public Health at the University of Maryland School of Medicine. She holds a JD from the University of Maryland School of Law, a Master of Public Health from Columbia University, and a bachelor's degree in public health from Johns Hopkins University. So thank you so much for being here tonight. We are very excited to have your input on this, very sensitive community topic. So let's go over to George Townsend, staff attorney with the Legal Research Center for Public Health Policy, Cannabis at the University of Maryland Francis King Carey School of Law, where he supports Maryland public health community through legal research, education, and advocacy related to cannabis policy. Previously, he worked with Maryland Volunteer Lawyers and the Legal Aid Society of Eastern Virginia. He earned his law degree from William and Mary Law School and his bachelor's degree from University of Chicago. George, thank you. We are very happy to have you here tonight. And then that brings us to our third panelist, Justin Kander. He is the founder of Cannabis for Cancer in Baltimore. He holds a Master of Science in Medical Cannabis Science and Therapeutics and is an author, speaker, and an advocate in the medical cannabis field with a focus on its use in the treatment of cancer. He is also the author of several books. So thank you all for being here. And Health Officer Levy, we're going to start with your opening remarks.
Good evening, everyone. Thank you so much for the opportunity to be here with you all. Really excited to engage in this conversation. When we think about cannabis from a public health perspective, there are a few things that are top of mind for us. One, as Dr. Osmond so eloquently spoke about, is youth and adolescent use. We want to make sure that we are supporting safe storage and preventing accidental ingestion from our youngest children. And we want to make sure that as much as possible we're delaying early onset of initiation of use for children and adolescents during these critical years of brain development. The risks are not the same for children and adults. The brain is very much developing until the age of 25, and cannabis use, particularly regular cannabis use, during those early years has a significant impact on brain development and impacts on attention, memory, and learning. Also the mental health challenges, as Dr. Osmond also eloquently spoke about, in terms of increased risk of depression and anxiety and increased risk of addiction. Vaping also comes with additional health risks related to lung health, and secondhand smoke can also be harmful for young people. So that's one area of concern. A second area of concern for us relates to parents, especially pregnant and postpartum women. We know that there is no safe level of use of cannabis during pregnancy or while breastfeeding. And I think with legalization, there has been a lowering of risk perception. People think because it's legal, it is safe. And Unfortunately, the research is still at a very early stage, and we don't really know what the impacts are, but the professional organizations like the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists say that there is no safe level of cannabis use for pregnant and postpartum women who are breastfeeding. And also for parents, if you're using cannabis on a regular basis, that can impact your attention, it can impact your reaction time, which are, those are important skills as a parent, as we all know. And I think the third area of concern for us in public health is safe adult use. So if people are struggling with use that they are finding increasingly problematic, if they are struggling with cannabis use disorder, we want to make sure that they are connected to care, that we are providing those strong linkages to them, to treatment, if they need it, and also making sure that people understand, and Dr. Osmond also touched on this, the risks of overconsumption and driving under the influence. It does take longer for the impacts after you have consumed cannabis, particularly in an edible form, for those impacts to be felt. And so you may be driving when all of a sudden you'll start to feel the impacts where you didn't realize, when you had gotten into the car. So those are things that we want to be mindful of. In terms of challenges that we face in public health, I think there are a few things. One is the shifting policy landscape. I think there's a tension always between the interests of the commercial market, and I understand this desire to, particularly in these tight budget times, to increase our revenues related to cannabis, but we want to make sure when we have these new laws being introduced that they are keeping the public health impacts in mind. I would also say a challenge for us in public health is the messaging, because the messaging isn't the same for everyone. It really depends on who you are and how old you are, where you are in the lifespan. And I think sometimes that nuanced messaging can be challenging for public health. I think it's a little easier when it's a black and white, like this is bad for you. We don't want to stigmatize people who are using cannabis, particularly for medicinal use, but we want to make sure that people understand the potential impacts, particularly for young people. And again, really promoting the safe storage message. And I think also, just making sure that people understand these differential impacts across the lifespan and on brain development. So yeah, those are the things that we're thinking about when we think about cannabis and from a public health perspective.
Well, Lauren, also as Harford County's health officer, you and your staff are the primary resource for accurate and up-to-date information on cannabis use and its impacts, just like you had mentioned. What partnerships and activities do you have with our public schools, with our law enforcement, our business community, and nonprofit organizations, especially those serving children and youth? And how can other groups like faith-based organizations, civil rights groups, and neighborhood associations, how can all of these groups really come to be more together, more united, and be supportive of what you're working towards?
Thank you so much for that question. So the work of public health is the work of partnership. I'm actually thrilled to see some of our partners here in the audience tonight. It is critical to what we do. Public health cannot act alone. We have to do this in partnership with our community. So in terms of how community-based organizations, how faith-based organizations can support us, I would maybe turn that question around and ask how the Harford County Health Department can be better supporting the community in terms of making sure that they have the information that they need. What can we do for them to help them keep their communities healthy? Make sure that they have the information ready, that we are supporting them with education and information about the impacts of cannabis, and ensuring that they feel comfortable talking about it, that they know that they come to us as a resource. So I really, our role, that's something that we talk about a lot, is our role is really to support the community. Certainly welcome their efforts to get that message out, particularly those messages we were just talking about the differential impacts of cannabis depending on where you are in the lifespan. And then in terms of partnerships we already have, there is so much great work happening in Harford County, and so really feel very fortunate to be working here with so many great people who are dedicated to this work. So we work very closely with Harford County Public Schools on a number of matters, certainly around substance use disorder, around mental health challenges. There is really a lot of tremendous work happening right now in behavioral health for youth, with Harford County Public Schools, Office on Mental Health, Harford County Health Department, so many community-based organizations, Voices of Hope obviously doing really great work in the behavioral health space, and we are fortunate at the Health health department to have partnerships with all of them. Of course, with our public safety partners, we're always doing a lot of work around response and making sure that our first responders have the support that they need, that they have the information and education that is necessary, and then, always looking to improve and expand upon the programming that we are offering. And so, doing a lot of work in the schools. Some of my colleagues are here tonight. They are going into the schools and sharing that education and sharing that messaging with our students, and it's really resonating. I talked a little bit about the challenges of messaging. I think the other challenge for us is making sure we are packaging our messaging in a way that's resonating with the audience that we're trying to reach, and I think that can be hard to do. There's a lot of things demanding our attention, and so trying to craft a message that really resonates with folks is something that we think a lot about and that we're really working on.
Well, we so appreciate your outreach and going out to the schools, because it really does make a difference, because even in Dr. Osmond's opening speech, I learned a lot of things that I didn't even know. So the more you know, the better off you're going to be. And George, that's going to take me over to you. Given your extensive background in marijuana and cannabis law and regulation, as we know they're changing, and what are the key issues we should understand today? What challenges are you and the broader legal community currently facing? And what does that recent federal rescheduling, there's a lot of questions around that, of marijuana, what does that mean for cannabis research, and what does that mean for other public health considerations?
Absolutely. Thank you so much for this question, and I would like to thank Don and the folks at Harford TV for the opportunity to speak with you all this evening. This is very correct that there are a lot of recent changes in cannabis law and policy here in Maryland. First and foremost among those, probably the biggest elephant in every room that I've been in for the last couple weeks has been the issue of federal rescheduling. There's a rescheduling order that was published by the acting attorney general on April 23rd of last month. And it's potentially, if cannabis is to be rescheduled from Schedule 1, which it has been at for the past 50 years, to Schedule 3 under the order, that's potentially the most significant change in federal cannabis policy of the last 50 years. To start off, though, I just want to sort of take us back to 2023. So July 1st of 2023, the state of Maryland legalized formally adult use cannabis. What does that mean when we say adult use cannabis? That just means that any adult over the age of 21 in the state of Maryland has a right to purchase and use cannabis products. Does that mean that any amount of cannabis use in any context is legal? No. There are a lot of protections and regulations we have in Maryland law included in the Cannabis Reform Act of 2023 that put in place public health restrictions and protections around cannabis legalization. So some of those involve the operating requirements for cannabis businesses. They have to maintain a dispensary premises that is not accessible to underage people. They have to ID people at the door to make sure that young people aren't going into businesses and picking up cannabis products and potentially walking out with them. It means there are regulations regarding cannabis advertisements. If a dispensary or a cannabis producer wants to sell cannabis products, there are very strict requirements about how they can advertise them to their customers. And there are requirements related to cannabis labeling, cannabis product testing, and other general public health requirements that ensure that this new industry that has been created is as safe as possible while still providing that access to adults over 21. Now, the first states to legalize cannabis for recreational use did so all the way back in 2012, which means by the time Maryland got around to legalizing adult use cannabis, we had over a decade of other state policies to look at, study, and learn from. And that means that relative to many other states that have legalized recreational cannabis, Maryland's laws are fairly well informed by observation of these other states and include some pretty significant public health protections. However, cannabis law has not been etched in stone and remained the way it was when it was first passed in 2023. And the last 3 years have been very dynamic, as every single Maryland legislative session has considered a slate of bills related to various aspects of cannabis, cannabis business regulations, cannabis public health regulations. So this is a very dynamic space, and I think it's very important that we continue to monitor the state of cannabis policy in Maryland and remain willing to make adjustments, which the state so far has done. So today I want to walk you through 3 primary policy areas that have had significant developments over the last couple months. We're going to start with federal rescheduling, and then I'm going to talk about 2 issues that we saw come up in this year's Maryland General Assembly and how they relate to public health concerns about cannabis. So, federal rescheduling. When we talk about rescheduling, we're talking about the Controlled Substances Act, which was a law, basically a comprehensive categorization and regulation of essentially all drugs in the US that was passed way back in the 1970s. And when the law went into effect, it scheduled cannabis as Schedule 1, which is the very highest level of control that the Controlled Substance Act has. There's Schedules 1, is essentially prohibited for personal use and possession. And then Schedule 2, 3, 4, and 5 are all drugs that have medical applications and can be prescribed as prescription medications, but are nevertheless subject to controls. You can't use them recreationally. They can only be used medically with a prescription. In April, the acting attorney general published an order essentially saying that the federal government is immediately moving medical cannabis from Schedule 1 to Schedule 3, and announcing that there would be a resumption of an ongoing administrative rulemaking process to reschedule all cannabis, which will pick up in over the summer, essentially. There's going to be a DEA hearing that's scheduled to start June 29th of this year, and after that hearing is done, and the administrative law judge publishes their finding after that hearing, potentially the DEA could reschedule all cannabis, adult use, medical, all of it, from Schedule 1 to Schedule 3. So what does this mean for us? In general, for individuals in the state of Maryland, residents who don't work in public health, don't work in the cannabis industry, this is probably not going to be a very significant change. And the reason for that is that the state process of legalizing cannabis has largely operated without any sort of involvement or oversight from the federal government for as long as states have been legalizing cannabis. Essentially, every state that has legalized cannabis, either for medical use or for recreational use, has done so without any involvement or oversight from the federal government, and in fact, essentially in spite of federal prohibition. So for us ordinary people on the ground, this is not going to constitute a very significant change when cannabis is moved from Schedule 1 to Schedule 3. The most significant effects are largely going to be on cannabis research and on the cannabis industry. And there are 2 key reasons for that. One is that under the Controlled Substance Act, any business that is selling a Schedule 1 or Schedule 2 substance is subject to pretty severe tax penalties. And that's part of why cannabis businesses take a long time to essentially get started up, is because they are subject to these very significant tax penalties. If cannabis is rescheduled, it would allow these businesses to operate a lot more normally in terms of their tax burdens, which would allow them to allow for more investment in cannabis businesses. The interesting thing about this specific rescheduling order is that, as I mentioned, the order only addresses medical cannabis. And in Maryland, we do have a medical cannabis program, so individuals can get a certification from their doctor to be a medical cannabis patient. What that does is it allows them to, 1, not have to pay the sales tax on cannabis products. 2, it gives them access to higher potency products than recreational adult users have access to. And the other key difference is that there isn't a strict 21 and over policy for medical cannabis, so a younger individual could get a cannabis certification. But the dispensaries are they're not separate dispensaries. There aren't medical dispensaries and recreational dispensaries. It's all one industry, which means that the way the tax burden would apply to Maryland businesses isn't very clear, and is something that's going to become more obvious over time. More relevant to public health, though, and I think to the public health community, probably the most significant consequence of rescheduling is that it will make it much easier for medical researchers to obtain cannabis and use them in clinical trials. So currently, back when cannabis was Schedule I, it was very hard for research institutions to get cannabis to perform studies. Essentially, they had to register with the DEA. There was a very difficult and involved oversight process. They had to get their cannabis from essentially the DEA itself. The DEA would acquire cannabis from the very small number of producers who were allowed to grow it, and then the researchers would have to get it from these very strictly controlled sources, and then use it in these very strictly controlled studies, which is very administratively burdensome, and not very many research institutions wanted to be involved in that hard work. So hopefully, as cannabis is rescheduled, it will be much easier for research institutions to get hold of cannabis and to develop the body of knowledge that we have about how it affects people, both in terms of negative side effects and in terms of medical benefits. We have some of that data already from these registered research institutions, but hopefully over time we will get more of that data.
George, thank you so much. Your excellent analysis of recent policy developments, because there's so many, I find it very hard to keep track of. But what that does have me question is, what issues, proposed laws, and state agency regulations do you see on the horizon? And more importantly, how can our audience stay informed and make their opinions known to the policymakers?
Great question, and I apologize. I meant to talk very briefly about rescheduling, but I do tend to get carried away with it. I think, mentioned on my slides, and I'll go very, very briefly into them, two of the most important issues that we've seen in the last couple of years in Maryland that have come up in our Maryland General Assembly sessions have been cannabis advertising and the industry trying to sell cannabis in venues that are not dispensaries. So cannabis events or selling cannabis beverages in alcohol retailers. We see both of these proposed changes as being very problematic because the regulations we have around cannabis advertising and around cannabis dispensaries as being very essential to our public health program. So specifically, every year for the last 3 years, there's been an attempt in the Maryland General Assembly to repeal the ban that we have on outdoor ads, which would allow cannabis companies to have billboards advertising their products. This is very problematic because if a billboard is outdoors, necessarily young people will be able to see it, and it will, studies have shown that individuals who are exposed to cannabis ads when they are adolescents or youth are significantly more likely to engage in underage cannabis use and develop cannabis use disorder. Thankfully, none of these bills have passed, so we do still have an outdoor advertising ban today, but it's important that we continue to advocate for that. It's also important that we advocate against releasing cannabis into communities in environments that are not well suited for it. So alcohol retailers don't have the public health and safety protections that dispensaries have to keep young people out and away from those products. And to the question of how we can advocate on behalf of our communities and public health, the answer is just to reach out to your legislatures. And I would in fact recommend doing it now, over the summer. So they meet and are in session in Annapolis from January to April. But the time of the year when they're not in session, when they're at home in your communities, is actually probably the best time to send them an email, make a phone call, explain to them your perspective and your views on the future of cannabis policy. And I would, in fact, especially recommend doing it right now because this is an election year. So they are even more than normal on their best behavior at the moment.
Absolutely, so important to make your voices heard, and that's a great way to do it. Thank you so much. Now that's going to take us over to Justin. Justin, you bring a unique and very valuable perspective to this discussion. Your advanced academic work, professional focus, and advocacy center on the health benefits of cannabis and the research behind its use. So I want to thank you so much for being here tonight and helping us better understand its potential role in addressing a range of medical aid and also mental health conditions, which is a very hot topic right now.
Yes, thank you. Yeah, this is a very hard turn from the other presentations, but it's very important for people to be aware of the risk of cannabis, and even within the medical cannabis industry, there really is a push away from THC toward the medical side, a push away from THC towards these other non-psychotropic cannabinoids like CBD. But yeah, so I can just get started. Can they see the slides up there?
They can.
Okay, well, I'll just talk and we'll go with it. We can skip the about me since you already gave such a good introduction.
Well, you
yes.
deserve it.
So what is medical cannabis? It's essentially the whole cannabis flower. So the cannabis plant produces this cannabis flower, and that is what is used medicinally. There is some more nuance there since other parts of the cannabis plant, including the roots, leaves, and even seeds, have some medical benefit. But what you see in dispensaries is almost exclusively from the flower. So these products can either be smoked, vaporized, consumed orally through a wide variety of different administration methods, and applied topically. So cannabis is not just one thing, and there are actually over 100 cannabinoids in the cannabis plant. And different types of cannabis are distinguished by the relative levels of different cannabinoids, as well as compounds called terpenes, which are found in thousands of other plants and have been shown to synergize with the cannabinoids to exert medical benefits. So there are two main cannabinoids. The first is THC, tetrahydrocannabinol, and this is responsible for the high of cannabis. And there's actually a synthetic version called Marinol, which is FDA approved to treat chemotherapy-induced nausea. So this went through the full phase 3 trials, and they found that this really was effective for treating conditions. Then we have CBD, which is non-intoxicating, but has several medical benefits. And there's an isolated version that's derived from the cannabis plant, not synthetic like Marinol, that's approved to treat rare forms of epilepsy. And just quickly on that, with Epidiolex, this was approved after children were seeing benefits from state-level CBD products where no other pharmaceuticals were working. So imagine this, you're a parent, you tried 10 different anti-epileptic drugs for your child, none of them are working. Then you try CBD, and in some of these cases, not all, but some, 100% seizure reduction. In other cases, it's 25 to 75%. But for these children, where literally no other pharmaceuticals were working, CBD was, and it went through the full phase 3 FDA-approved trials, finding that what the people were reporting anecdotally was indeed translating under controlled conditions. And then there's a bunch of other cannabinoids like CBG, CBC, CBN. And while there's some more nuance to this, THC is the big driver of both the psychoactivity and the negative effects of cannabis. There is less research on these other cannabinoids, but what has been looked into is they're, I don't want to say nearly harmless because there can be issues, but it's far, far less harmless than THC. All the negative effects that you've been hearing about tonight, which are very real, are almost exclusively related to THC-rich cannabis. And thankfully, the medical industry is at least starting to move away from that to these other non-psychotropic cannabinoids that have far, far less risk. So going on to types of products, we have the whole flower. So this is just standard marijuana. You take it out of the container and you can either smoke it or vaporize it. We have infused oils, which I believe is the most useful and medicinal type of cannabis product because it enables very consistent dosing, and of course you're able to avoid any smoke, which is not good, full of carcinogens and the whatnot. So infused oils are made by soaking cannabis in either olive oil or MCT oil, and then filtering it out, and you have the infused oil. Then you have edibles. I'm sure you've all heard of brownies and gummies and such. There's also extracts, so these are the most concentrated forms of cannabis, and also, potentially the most problematic. So this is what, the kids who are vaping cannabis in schools and such, they're not vaping raw cannabis, they're vaping these oils, and they're very, very potent, and that's really the risk with them. There is very legitimate medicinal use to extracts, but they generally should be reserved for people with, severe cancer pain and other conditions that, really need those high doses. And then finally, we have topical, which is really great because even THC-containing topicals don't get you high because it doesn't penetrate the skin without special permeation enhancers. So for local relief, people can use THC and CBD-rich cannabis without any psychoactivity. So importantly, over the past many years, there have been formal clinical trials, both the gold standard double-blind placebo-controlled, as well as observational trials, showing that cannabis preparations can benefit a wide variety of conditions, including anxiety, depression, nausea, vomiting, anorexia, pain, sleep, headaches, the spasticity associated with MS, and more. So getting into just a couple of examples, this one double-blind placebo. And just to be very clear, so double-blind means that neither the researchers or the patients know what they're getting, and placebo means that one group gets real cannabis and the other gets fake, and they don't know that it's fake. So this kind of research design helps eliminate the placebo effect essentially and increase the validity of the results that are seen and reported. So in this initial study, the patients were given doses of and this is for intractable cancer pain, so very severe pain that is not responding well to conventional medicines, that patients on between 22 to 32 milligrams per day THC and 20 to 30 milligrams CBD per day, twice as many of them had a reduction of more than 30% from their baseline pain scores than placebo, which is really significant for a level of pain of that level. Next, we have insomnia, which affects a lot of people. And this was another double-blind placebo-controlled study showing that a combination of 10 to 20 milligrams per night THC and low doses of other cannabinoids, CBD and CBN, helped patients fall asleep faster, sleep for longer, had improved sleep quality, and felt more rested and refreshed in the morning. Of course, over time, these you can need dosing changes in order to make sure that you're avoiding side effects, but many people can stay at the same dose for many years and still get relief. And if you do find that you need to keep increasing, as some people do, then you need to look into other modalities to make sure that you don't fully rely on it and get to too high of a dose. So going into the preclinical evidence, this is evidence with cells in animals, and it's where all pharmaceutical research starts. Before you go to humans, you want to see how it's working in isolated cells and how it's working in animals. And this evidence is really, really promising. There are hundreds and hundreds of studies, probably thousands at this point, showing that the main cannabinoids, THC and CBD, can help mitigate the underlying processes associated with many diseases. So for example, Alzheimer's disease is caused at least in part by the accumulation of something called amyloid beta plaque and the hyperphosphorylation of tau proteins. Essentially, these protein clumps form in the brain that inhibit brain cells from communicating with each other, and that leads to symptoms of dementia. And in this summary study that looked over many studies preclinically, specifically with CBD, as noted, recent studies using an Alzheimer's disease mouse model have suggested that CBD can reverse cognitive deficits along with the amyloid beta plaque-induced neuroinflammatory cognitive deficits or oxidative response and neuronal death. Furthermore, CBD can reduce the accumulation of the plaque and the hyperphosphorylation of tau, suggesting the possibility of delaying Alzheimer's progression. Now again, this is preclinical, this has not been shown to work in humans, but many physicians that I've worked with have been seeing amazing results in dementia patients that we're working with who are not responding to any of the standard medications being administered at nursing homes. Dr. Dustin Sulak, I encourage everyone here to check out. He's my favorite cannabis doctor and has done a lot of work with dementia patients, seeing absolutely amazing results. So, who knows how it's making it, but it could be working at the actual disease level to affect the plaque. So moving on to the endocannabinoid system. Many of you may not have heard of endocannabinoids, but you probably have heard of endorphins. Endorphin is short for endogenous morphine. So it's essentially the self-made opiate or morphine that the body makes. And endorphins bind to natural opioid receptors in the body to fight pain. Just like we have endorphins, we also have endogenous cannabinoids that bind to cannabinoid receptors, CB1 and CB2 throughout the body, that ultimately have homeostasis or balance regulating properties. So essentially, if a process such as neurotransmission of glutamate is overactive, then endocannabinoids are produced on demand to help rectify it and bring it down to the right level. So basically, how it's described as the endocannabinoid system is a regulator across different body systems in order to maintain homeostasis. And it's implicated in the regulation of immunity, digestion, pain, energy, neuronal communication, and more. And then the little little chart here shows the distribution of the different cannabinoid receptors through the body. Don't need to get too deeply into this, but the wide distribution of this network demonstrates how important the endocannabinoid system is, since we evolved with these receptors. You know, all mammals have it, and the endocannabinoid system began evolving hundreds of millions of years ago. So it's very important to our form of life, and that's why we need to be careful with it and not overstimulate with THC. And then this is a really, really fascinating article. The endocannabinoid system as an emerging target of pharmacotherapy. This is just, I love this article. But so researchers with the National Institutes of Health summarized hundreds of studies showing how alterations in the ECS both are implicated in the pathology of a wide variety of diseases. So basically compared with healthy counterparts, both in humans and animal models, the cannabinoid receptors are either higher or lower, or the endocannabinoids are higher or lower in these disease states. So as you can see what it's covered, appetite, obesity, pain, inflammation, stroke, MS, Parkinson's, Huntington's, ALS, Alzheimer's, epilepsy, the list goes on. And the amazing thing is that there is matching preclinical evidence showing how cannabinoids, mainly THC, CBD, and CBG, can affect the underlying disease processes with all of these conditions. So it sounds pretty crazy, but don't shoot the messenger. That's just what the research shows. So moving on to what real patients report. For decades, real patients have been saying that both informally and indirectly via the clinical and observational trials, that cannabis is having a profound effect on their quality of life. In my over 18 years of being involved in this, I've seen countless patients have their lives absolutely changed, and in some cases saved, through the judicious use of this plant. So closing up with some future directions, I believe, and from being involved in the movement, I actually just came back from Australia a few months ago where I spoke at a conference, and there was a really great presentation on the non-psychotropic cannabinoids. But this is where the movement is headed, using less THC and more of these other cannabinoids that have far less risk. THC is a double-edged sword because it can impart significant relief, and it is important for many people, but of course it has side effects, especially with the long-term high-dose use of inhaled THC. By working together to educate people and use these other cannabinoids, we can dramatically reduce the use of THC and avoid a lot of those issues. Excellent. That seems good.
Thank you, Justin, so much. I mean, that's a great perspective. That's a lot of information. That's a lot to take in, but it's great information and it's very, very helpful. So we appreciate that so much. Now, before I proceed with our panelists, we'd like to take a question from the audience.
Good evening. My name is Eric Stricko. I am the Recovery Friendly Workforce Advisor for the Susquehanna Workforce Network. My question this evening is this. From your perspective, what are the most immediate priorities in addressing marijuana use and dependency, whether in terms of expanding programs and services, strengthening public awareness efforts, or developing more targeted initiatives for youth, individuals, and families?
I guess I'll go.
Lauren, you can start, yes.
Okay, thank you. Thank you for that question. So I think in terms of immediate needs, again, we want to make sure that folks who are experiencing that dependence, who are concerned about their use or the use of family members, that we make sure that they are connected to the services that they need. There are a lot of wonderful treatment providers available in the county and beyond, including at the Harford County Health Department. So we want to make sure that people have awareness of those services, and that they know that if they call the health department, whether you get your services with us or with another provider, that we can make sure that you get connected there. So I think making sure people have awareness that they can always call us and we can help provide those supports and potentially those services. I think also in terms of George touched on it a little bit, the collective advocacy piece, just making sure that we ensure that the public health protections remain in the laws. I think that's also critical to reducing risk of dependence over time.
Thank you.
George?
Yeah, that's a great answer. I have very little to add to it. I think I would just want to highlight that, again, I do really believe that the Cannabis Reform Act included a lot of very important and valuable public safety and public health protections, and that it's just very important that we recognize those, celebrate those, and advocate to keep them in place, especially as we start to see more pressure from the cannabis industry to roll back those protections. So when public health protections work, we can lose sight of their value because people don't notice the policies that are working. We only notice the policies that are failing. So it's important for all of us to be advocating for these policies and celebrating the aspects of them that are working and acknowledging the parts of them that could work better.
Justin?
Yeah, I mean, I'm all about education. Education is how you move things in the right direction. I'm definitely against outright prohibition because that does a lot more harm than good. But by having the right educational programs and getting the knowledge into the hands of the people who need it, I think it'd be really helpful. Like a lot of people, students don't know about the endocannabinoid system and that the continued high dose use of THC can downregulate their CB1 receptors and make it hard, increase the risk of anxiety and potentially other conditions. So when you give them the science and be like, hey, you have this really important system that you want to keep healthy, or it controls homeostasis, you mess it up through really consistent THC use, that you're not going to have a good time later on. So that kind of thoughtful education I think is really critical.
Hey, Lauren, George, and Justin, thank you so much. It was such valuable information. We so appreciate you taking your time tonight to answer these questions. You answered a lot of questions. I know that there's a lot more to come, but thank you for being such community advocates. We really appreciate you. And now let's give a round of applause for our first panelists. And I'd like to invite our second set of panelists, and here's Don Mathis to introduce them.
Justin. It's my pleasure to introduce our second panel, Health Impacts, Risk, and Youth Prevention. On the far end, A.L. Reeves is the founder and director of Boys to Men Mentoring Program in Harford County Public Schools. Now operating in Joppa High School as a retired pastor who has dedicated his career to education, serving as both an educator and administrator in Harford County Public Schools and Denver Public Schools. Mr. Reeves also served as program manager for the College and Career Readiness Division of the Blueprint for America Schools through the Susquehanna Workforce Network. Sandy Gallion in the middle serves as an EMT and prevention coordinator, for the Harford County Office of Drug Control Policy. It's a role she has held for 7 years. She's also a prevention specialist, recovery coach, CSIM trained peer support worker with the Department of Emergency Services. Before joining the Office of Drug Control Policy, she dedicated 34 years, you're not that old, she dedicated 34 years to an internal medicine practice. She also volunteers as an internal medicine. She also volunteers as a first responder at the Level Volunteer Fire Company. Sandy brings a unique perspective of professional expertise and personal experience to her work in substance use prevention and recovery. Jennifer Redding, in the tasteful green dress, is a licensed clinical social worker. She's also the founder and CEO of Harford Counseling. Her previous leadership roles include Executive Director of Behavioral Health Services at the University of Maryland Upper Chesapeake Health, Deputy Chief of Client Services for Family and Children's Services. She is a certified trauma-focused cognitive behavioral therapist. She also has experience with adverse childhood experiences, interface, and other therapeutic specialists. I'd like to thank our panelists for being with us. I want to start with A.L. A.L., I'd like it if you could share your experience in working with students, what you see every day, and the impact of marijuana and cannabis on the students you see. Go ahead, sir.
Well, I think it's probably kind of dangerous to give a microphone to a pastor and then tell him he's got like 10 minutes. First of all, we'll probably start with this, since most of the group is in the middle. I do have deacons in the back that will be collecting offering after this point, so let us be mindful of that. Let's get right to it. We are in probably the greatest battle of our lives. The students that I serve at Joppatown High School and Magnolia Middle School in my Boys to Men mentoring program, which are about now 175 boys. Out of those 175 boys, we did a study. 90% of those boys that are in my program are vaping. Let that marinate. 90% of those boys in my program started vaping when they were in the 6th and 7th grade. They are now high school students. Telling those students to just stop after they've been vaping for the last 4, 5, 6 years is impossible. Many of those students have become now addicted to this. They come to school, and just to give you a reference point, in this bag, and I hope everyone can see this, these are the vapes that we have collected. These are the ones that we have caught. This is just in the last month or so. Do we have a problem? Absolutely. When I left Harford County and went to Denver, the major battle was dealing with gangs. We turned from that now. This has become a one-on-one situation. Some of these vapes that are up here range in price from $50 to $25. You tell me, where is a high school student get $50 every couple weeks to buy vapes and saying that they need it? The severity of what we're dealing with is astronomical. And I want to check you now. If you think it's just Joppatown High School, or you think it's just Edgewood or Havre de Grace or Aberdeen, let me wake you up. It was just in the news. Bel Air has this same problem. You remember the story that they talked about where they had to go and unclog toilets at $200, $400, $500 was in the news? That was Bel Air High School. It's not relegated to just Route 40. It's not relegated to the northern end. This is a county-wide problem, and I'm going to go deeper. I've got some students in elementary school in Baltimore County in the 3rd grade who are vaping.
And AL, we're talking about marijuana here that they're vaping also, right?
That is
This isn't some
exactly what
kind
I'm
of
talking
harmless
about.
thing.
This is the gold card. We just took this one from a student, 10th grade, vaping marijuana. So you say to us probably, well, what can we do to stop this in the schools? I'm just going to be direct with you. It's not just the schools. It's our whole community. It's our parents. It's our community leaders. I'm thankful that I had a county executive, Mr. Castley, who took the time to call me up and pull together a grant program that we could begin to affect this change. It's a battle, and we're fighting it every day. I lost 2 boys today because of this, 10 days out of school. Any of you know what 10 days out of school can do to a student's GPA in academic studies? 10 days out of school, you're so far behind when you come back, you can't catch up. This is real. This is impactful. And I'm doing everything I can right now to not cry at this moment, because I've got parents who come to me and say, what can we do? We're in a war. And at some point, it has to change. Let it settle in. It's real. and our students are involved. Grades 8 through 12 is who I serve. 8 through 12. I probably should have went into therapy for lung and breath rather than be a pastor. Money is making this happen. Money is driving this force. And we have to wake up to this and face it head on, all of us, collectively. It's not a black issue, it's not a white issue, it's not a rich or poor issue. It's a humanitarian issue, and it's real to us every day.
Thank you, A.L. Thank you for your empathy and really caring about our students. Sandy, you bring a wide range of professional and lived experience to your work. Could you tell us about your role at the Harford County Office of Drug Control Policy, particularly as it relates to students and youth? Then I'd like to hear your thoughts about what A.L. just said.
Thank you. I do bring a different perspective, but I also bring a lived experience because I lost a son to substance use. So that is where my passion begins.
Yes.
And that is how I ended up at the Office of Drug Control Policy. I actually volunteered with him for 4 years before I even started working there. But since I've come on board and the struggles that we see, we work really hard. The Office of Drug Control Policy is just not about giving the education, it's about caring for all of the youth. And we've tried to expand the programs across the board. So when we're talking about what the Office of Drug Control Policy is doing, we are working within the school systems, we're working on programs. We go into the school systems from elementary school along with the Harford County Sheriff's Office, the Pledge program. We go into there and we teach the kids between the ages of 3 and 5. And believe it or not, those kids can know this. They learn this information. I will interact with these. I'll see these youth. Some of them, like Friday night when we're at the Your Mind Matters, we'll have several kids that were in the program this past year come up and they'll recognize us and they'll talk to us. And we'll ask them a question, something as simple as what's legal and what's not legal as far as a drug. These kids can remember this. So we need to start at a very young age at elementary school and start learning with them then.
That's right.
And the big thing is that we have to also teach them things like coping skills, because we recognize that youth don't know how to handle their emotions, they don't know how to handle their thoughts. Sometimes they act out angrily. If we start at a young age teaching them those coping skills, then they can use those coping skills to move forward in life and not turn to a substance. And that's the same as peer pressure, because we know that it's going to be a friend or a family member that's going to offer them something the first time. It's not going to be a stranger. It's not going to be a man in a van with a lollipop. It's going to be someone that they know. And so therefore we want them to learn how to refuse that stuff, how to walk away. We also work within the middle school age youth as well. We teach them in the health classes along with the health teachers, and we cover everything from alcohol right on through nicotine, caffeine, all of those drugs that are readily available and they see on a regular basis in their homes and in restaurants. But we also get into that vaping. We talk about that vaping and the risk of those youth, that may have popcorn lung. Then we move on into the other stuff, that like heroin and fentanyl and all the adulterants that are in there, talking to them about their risk. But in the middle school age, we talk to them about choices that they make and how those choices they make can affect their lives forever. So we talked about that. And then when we talk about, what's going on in the high school level, and particularly what A.L. was talking about, he talked about money that he got from Harford County. That money came from ORF funds and cannabis funds is where we're giving these grants out. This allows these nonprofits to work and to provide things that are useful within the school systems, within their organizations.
Can I just interrupt you? It's important that the people know that that is not taxpayer money.
Correct.
That this is money from the court settlement.
That's right.
So
Correct.
these services are being paid for not by your tax dollar, but what the pharmaceuticals did to our children.
That's correct.
Absolutely.
Thanks, Sandy.
That's correct.
Absolutely. And a lot of our youth have been affected. They've been affected because of the fact of what happened with Purdue and what all happened in the pharmaceuticals. And those funds have trickled down from the federal government to counties all across the state of Maryland. And so we take some of those funds as well as some of the taxes from the cannabis, the purchase of cannabis, and that allows us to allow people like AL to work with the Boys to Men Club, which he does. In addition to that, we go in and we were right beside him.
That's
So
right.
we've been in there every month for the last 3 months.
That's correct.
I worked with a group of great young men about 2 weeks ago, and they're getting it, but they're also struggling. And the more that we can do with them, the more education, the more talking to them, the better it's going to be.
Oh, you got to give it up for her for that. Come on now.
Thank you, Sandy. Jennifer Redding, you are a highly respected clinician, and I've been in trainings that you've done, and they're like passing the collection plate right now.
Yeah, get it.
You're a management consultant, you're a wellness trainer, you're a public health advocate. Could you share some of your work with Harford Counseling? And then I'd like your responses to what AL and Sandy said.
Sure. Good evening, and thank you for letting me be a part of this conversation tonight. I want to start with a moment that may feel familiar to many of us in this room. A young man sits in front of me and says, "I don't think it's a problem. I just use it to calm down." He's not failing at school or work. He's not in crisis. He's functioning. But as we talk more, a different picture begins to emerge. His anxiety is getting worse, not better. His sleep is more inconsistent. His motivation is declining. And without realizing it, what started as a coping strategy has quietly become something he relies on to feel okay every day. From a mental health perspective, marijuana is not neutral. And I think it's important to name that right away, because in many conversations, it gets framed as either helpful or harmful. But in the work that I do, it's rarely that simple. For many people, marijuana use isn't just about recreation, it's about relief. Relief from anxiety and racing thoughts, relief from insomnia, offering a temporary escape from stress or emotional pain. And that matters. Because when we look through a trauma-informed lens, we don't just see marijuana use as a behavior, we see it as a part of a larger story. A story about nervous system regulation, about stress, about trauma, about access or lack of access to healthier coping strategies. And if we don't understand the function of the behavior, we risk missing the opportunity to address what's underneath it. At the same time, we also have to be honest about the impact on mental health that we're seeing, locally and abroad. For some individuals, marijuana use can exacerbate underlying anxiety and depression. It can impact cognitive functioning, such as things like attention, memory, and decision making. It can contribute to mood instability and decreased motivation. And in more vulnerable populations, particularly adolescents and individuals with pre-existing conditions, it can increase the risk of paranoia and in some cases psychosis. So the conversation becomes more nuanced. It's not just whether people are using, but who, why, how often, and in what context. We also have to consider what's changed, and we've talked about some of this tonight. But the marijuana being used today is different. Higher potency products, increased accessibility, and early initiation all shape the level of impact, especially when we're talking about developing brains or individuals already navigating mental health challenges. And from a broader perspective, we're seeing something else emerge. Marijuana is increasingly becoming a primary coping strategy. So the question becomes, what happens when a coping strategy becomes the default? Because coping strategies are meant to support us, but when one strategy carries the full weight of nervous system regulation, it can start to limit growth, resilience, and long-term stability. This is where I think we have an opportunity to shift the conversation, Not towards extremes, not towards it's safe or it's dangerous, but towards understanding. Understanding the role that marijuana is playing in someone's life. Understanding the needs underneath that use. And understanding how we can better support individuals and communities in ways that are sustainable. Today, my goal is not to polarize, to take a polarized stance, but it's to bring a clinically grounded, trauma-informed perspective to the conversation. Because when we move beyond assumptions and into understanding, we create space for better care, better policy, and better outcomes. Ultimately, this isn't just a conversation about marijuana. It's a conversation about how we help people cope and how we help them build lives where they don't want or have to rely on a substance to feel okay. Thank you.
Thanks, Jennifer. Before I give the final question to the panel, we have an audience question.
Good evening. Good evening. My name's Nielsen Carroll. I work at Voices of Hope. I'm a certified peer recovery specialist and a person in recovery. I have a two-part question. First, there are some doctors and clinicians who recommend that people with opioid addiction or opioid use disorder use cannabis as a tool or a step for them to stop using opioids. Do you think that's a good idea? My second question, can you offer some coping skills for family members, friends, and concerned others that will help people that have serious issues or problems with marijuana use?
Sure. I will start by saying I'm a social worker. I'm not a medical doctor or physician. I can only speak to my experience. I've been in the world of mental health for about 30 years, and yes, I'm that old as well. I do not necessarily think it's a good idea to substitute cannabis for opioids or vice versa. I think we're missing the point. I will say that in working with a number of individuals through the years who have used substances as a way to quiet their brain and to live life, we have to give coping skills before we take away that drug. Otherwise, it's going to be a revolving door. Coping strategies in general, it's sort of what I spoke to, in my opinion and experience in working with lots of folks and just living life myself, it's about nervous system regulation. We get activated when we think there is danger. So our fight-flight response, that's what I mean by nervous system regulation. And so when you compound long-living trauma, child abuse, any other numbers of trauma, living in poverty, living with instability, that programs your brain to live in fight or flight. And so, oftentimes folks aren't looking to set out to abuse or use drugs. They just want to quiet their brain and be able to live life. And so we have to get to the root of that and create some things. There has been amazing, and I'm going to be done in just a minute, there's been some amazing strides in research on brain science in the past 5 to 10 years, and really understanding how our nervous system works to protect us, but sometimes it misreads cues. And so there are simple breathing techniques that science now backs up. It's really amazing, and I was a slow joiner, but there really is science behind it. And once you learn some of that, it's powerful in how it can sort of tone down the nervous system. The other huge piece in my world as a human and as a therapist is just the power of connection. People feel alone.
Absolutely.
They feel like their story, their experience, they're the only one that's experienced it. And so helping folks feel like they're not alone and that they're connected, that's also really where it's at. I've talked enough.
Thank you, Nielsen. Thank you, Voices of Hope, for being a sponsor. So my wrap-up question for each of you, because you're so widely experienced, what's missing? Are there programs and services we should be doing that we're not doing? Are there things that we're doing we should invest more money in and accelerate? And is there stuff that we are doing that we shouldn't be doing? It's not working, or maybe it's misdirected. So you can take your pick.
Yeah, I'm going to start with programs that we should be doing more. We need to be actively involved earlier in education with our students, reaching them at the level where they are. And Sandy's been fantastic with us, coming and speaking to the Boys and Men group. But we really need to be impacting at an earlier stage. Elementary school is not what I want to say, I guess. It's too early. It's never too early. And so elementary needs to have that impact. So I would love to see more activity at that level going forward, and then wrapping families into what's happening, because the families are directly affected one way or another. Either they're producing it or they're watching this happen with their children, and that needs to be changed. So
Thank you.
I mean, I concur with the attitude it has to be younger. In fact, I'll talk about a program that we currently do when we go to events. We have a wheel, and of course that attracts everybody who wants to spin the wheel. But the youth come in.
that's true.
It is.
It is.
They come up, and what they do is they spin the wheel, and they have to tell us whether it is candy or medicine or something else. A large portion of the wheel has cannabis on it, cannabis products, things like cookies and Doritos and Skittles and gummies, all of those things. But we don't talk about where they can recognize them. We talk about that youth, about the fact that there is that risk, that we do have these, cannabis products that are out. And there's been such an increase of youth that have accidentally ingested them, not knowingly, and then end up in the ERs.
Yeah.
What's happening is that's happening more and more often because of the legalization of the medical marijuana as well as the recreational. But see, the thing of it is that we talk not just to the youth, but to the parents.
Correct.
And that's the key thing. We explain to the parents, the bottom line is they need to ask before they take anything from anybody. Even if it's a friend's house, they need to know that. So it's involvement of the parents. The problem is that we can't necessarily get the parents involved because the parents don't come. So programs that we're missing are programs where we can have the parents come, maybe even a situation where we are doing two different things at one time, where we're talking to the youth and talking to the parents both. That's a big thing, because without education, which is the key to everything that we do, it is hard to do that. The other thing is decreasing that stigma that's associated with a lot of different things, including substance use. So when we start decreasing that stigma and letting people know it's okay to talk, it's okay to talk about their emotions. Being a first responder, we don't like to do that. We're big bad people and we don't have emotions. And if you're a female, you even more so don't have them. But we need to talk about our emotions. So that's something we're missing, being able to talk about what's going on, those good coping strategies that Jen had talked about, and offering those coping strategies, as I said before, to our adolescents, and allowing them to know that it may be just something that's a good self-care. What makes you feel good? If that makes you feel good in that moment, then turn to that feel-good thing that you do instead of turning to that substance. But across the board, I think education is the key thing, and involvement of the community.
Correct.
Thanks, Angie. Jen, we have any icing on the cake?
I think we have to think of the big picture. Oftentimes things don't just start in a vacuum, and so kids and their parents and their caregivers and the adults in their lives, we have to bring them all together, and we have to also not assume that the adults in the picture have the coping strategies and they have the regulation, the nervous system regulation. We have to teach that across the board, because if we can teach the adults, whether they're parents or caregivers or just people that are around that child, they're going to then be able to teach the child in those tough moments and be able to name what's happening. Sometimes when we have those emotions and those feelings, they're scary and they're confusing and we don't know what's happening. And again, we feel like we're all alone. If we can sort of just very calmly sort of name what's happening so that you don't feel crazy, you don't feel alone, and that, if you can do X, Y, and Z, it's going to pass. It's going to be okay. This isn't forever. That's what gets things through, and just collectively, folks don't feel the need to have to rely on anything other than themselves to feel okay.
Please join me in thanking these three everyday heroes for their great work. Thank you, thank you. So Christy's going to close us out, but I have 5 points about what we wanted to try to do tonight. Number one, recognize that addiction to marijuana and cannabis is real, formally recognized by medical diagnosis that marijuana use by young people is risky and it's not a rite of passage. Two, recognize that marijuana today is far more potent with significantly higher THC levels than even a decade ago. Three, remind students and young people that only adults aged 21 and older may legally possess or use cannabis, and underground online sellers that they may buy from may be selling them poison. Four, there are treatment programs that are effective in helping young people stop using cannabis. Evidence-based prevention programs can discourage students and others from using. And finally, it's important that we all stay informed about marijuana and drugs in general. The more we know, the better we do. And as our health officer, Lauren Levy, will often remind us, it takes a community to help make a difference. And that's what you all have done here by coming here tonight. Thank you very much.
And ladies and gentlemen, please a round of applause to Don Mathis, who has worked tirelessly to put this together. What a wonderful job that he's done. We really hope that you've enjoyed tonight's program. It's going to air on Harford TV throughout June. Visit harfordtv.org for air times, and do not forget to pick up your complimentary box of Narcan as you leave. This is courtesy of Voices of Hope. A huge thank you again to Don Mathis, single-handedly put this program together each year. We also want to thank our panelists for participating, all of our sponsors, all of our endorsers, and the team at Harford TV. On behalf of the Harford TV Foundation, I'm Christy Breslin. Thank you for joining us tonight, and knowledge is power. Thank you for taking the time out of your busy schedule. Your information was very informative and very helpful, and thank you to all of you that are here tonight to help us solve this community problem together. Have a good night and drive safe.